Good evening and welcome to Health Check, your weekly show touching on matters surrounding your health. Tonight on Health Check, we talk about vitiligo, a skin condition which patches on the skin loses their color, resulting in spots and patches of lighter color. Vitiligo can develop anywhere on a person's skin, including their face, their arms, hands, and feet. To help us understand this topic, we have a dermatologist as well as a person who has been living with this condition for years. Together, they will help us navigate this condition and have a better understanding. And we encourage you to share this link, which is live on Facebook and YouTube, with your friends or somebody who will benefit from this discussion tonight around vitiligo. Our pages are at Hope TV Kenya. Remember, you can also engage with us. Our WhatsApp line is 0708 222 323. That is 0708 222 323. And our SMS line is 20933. That is 20933. Of course, start with the word health check. Good evening. My name is Grace Mutiso, and I hope that you had a beautiful one, a new week, a new topic, and new guests. And allow me to invite our guest today. I'll be hosting Dr. Margaret Gashanja. She is a dermatologist, and of course, Felix Owing has been living with vitiligo for a while now. Good evening, Dr. Ari.
Good evening, Grace.
You well?
I'm well, thank you.
Okay.
Yes.
Take a minute to tell us a little bit about yourself and what you do.
Okay, thank you for having me. My name is Dr. Margaret Gashanja.
Yes.
I'm a clinical and cosmetic dermatologist. So I deal with everything skin, hair, and nails. And my practice is based at West Park Suits building. That's on the 5th floor, along Ojiji Road in Parklands.
Okay, I'm interested in the nails. Okay. We'll talk after the show. Good evening, Felix.
Good evening, how are you?
I'm fine, and you?
I'm doing well.
Good. Tell us a little bit about yourself.
Oh, well, so my name is Felix Owing. I'm a model. I'm also a biomedical engineer. Yeah, and I'm also a vitiligo advocate. Yes.
Wow, model, engineer, and vitiligo advocate. A great combination right there.
Yes.
Karibuni sana.
Thank you.
So let's start with Dr. Margaret. What's vitiligo?
So vitiligo is a chronic or a long-term skin condition that basically is characterized by the loss of skin pigmentation on the skin that leads to white patches on various parts of the body. So this is due to destruction of melanocytes, which are the pigment-producing cells in the body. So it basically affects people of all age groups and women and men alike, and are very common in our society. About 1 to 2% of the population usually has vitiligo.
Okay, you've mentioned something around pigment that is affected.
Yes.
Could you go into detail? What's happening around there?
So what usually happens, our own body has the immune system that's supposed to fight off infections, but in this case, it mistakenly fights off melanocytes, which are usually pigment-producing cells of the skin that produce melanin that makes up our skin color.
Yes.
So they're mistakenly destroyed, hence loss of pigment on the skin.
And you know, a parent could be watching and saying, could it be something I ate during pregnancy or something I didn't do or I did during pregnancy? Could you help us demystify that?
Okay, so usually autoimmune conditions, of which vitiligo is, they just come about on their own. It's nothing to do with diet, it's nothing you have done. They just happen sporadically where your own body mistakenly starts fighting good cells which are supposed to be in the body doing their work. So it's just something that happens sporadically and no particular cause has been found yet to lead to vitiligo. It just happens on its own. There are some predisposing factors. For example, if members of your family, whether a first or a second-degree relative, has vitiligo, then that can predispose you to have it. Or if you have any other autoimmune conditions, such as commonly diabetes or a thyroid condition, that can lead you to develop vitiligo. But other than that, it tends to occur just sporadically, where your own immune system mistakenly starts fighting its own cells.
Okay. And does it happen during pregnancy or after a child is born?
Okay, so ordinarily, vitiligo has 2 peaks of incidence.
Okay.
So the first peak, which is early, develops under 10 years of age. Then there's a later peak, which occurs around 30 years of age. But the average age of vitiligo is between 20 to 24-year-olds. So you can have babies as young as infants who have vitiligo, and even the elderly. So it can occur at any age, across all age groups.
Okay.
Yes.
If we get to Felix, there are types, or just vitiligo is vitiligo? And if there are types, what differentiates them?
Okay. So vitiligo broadly has 4 types. So the first one is unsegmental vitiligo. So this is vitiligo that basically tends to be asymmetric, meaning occurring on both sides of the body, which we call bilateral. And it can affect various parts. You can have the lips being affected, as well as the fingertips, for example. So usually both sides of the body. There's also the segmental vitiligo, which occurs in various parts of the body. So you can have maybe just one hand affected, one foot affected. So various segments of the body are affected. A third type of vitiligo is a mixed form, whereby you have both the segmental and unsegmental combined. So that can occur just, any part of the body can be involved. And then a final type of vitiligo, which is called the unspecified. This one is quite sporadic. You can have all those combined, as well as certain types of vitiligo where you have like raindrop depigmentation of the skin, as well as even the mucosa that's inside the mouth involved. So it's a bit unspecified. So you can't really class it into anything. So basically, those are the 4 major types of vitiligo.
Okay. Okay, thank you so much, Dr. Margaret. Let's go to Felix. So at what age did you or were you diagnosed to be having vitiligo?
Oh, okay. So when I was diagnosed, my vitiligo started way back in 2008, and when it started, by then I didn't know that it's vitiligo because it started on my lips. So my lips just started turning the color, and we started looking for the medication, of which we were just looking for the medication, but we didn't know what we are really trying to treat. Even the doctors couldn't really tell that it's vitiligo by then. It progressed day by day. It went to my neck area, and that's when I was diagnosed that it's vitiligo. That's when now the doctors could tell that this is vitiligo. So it just progressed like that. Yeah, and that's how I was diagnosed that I have vitiligo.
At what age was that, if you can remember?
By then I was around 9, 10.
Okay.
Yes.
So what symptoms, or what were you experiencing for you to say, something is not right with me?
Actually, there are no symptoms. You can't tell that something is happening to you. You will just see a change of color. There is no. It's not like malaria that you feel like you have an headache or something. You necessarily don't feel anything. You just see the changes coming. Yes.
Okay. And you've said at the age of around 9, 10.
Yes. Yes.
How
yes.
did that affect you growing up? Now you look like an older man, a model and an engineer.
Yeah. Sure. Vitiligo is a funny condition. It's not like it's not something that you're born with. Most of the people develop vitiligo when they are old enough, when they have grown. So it's something which takes you to another life, another way of life, like another different life. It's not like this the normal. You see, it changed my life in that the way I was relating to the kids in school changed so much, because now they knew you as a normal person. Your skin was just normal, but now your skin started having some spots, and people will start questioning you. People started questioning, like, what's happening to you. Some just laugh, some think that you get banned or something like that. Yeah, so it changes your lifestyle. Vitiligo actually changes your lifestyle, because it's a new other lifestyle that you are getting into when you have vitiligo.
Okay.
Yes.
And I'm hearing you mention it really changed your life, and you had to adopt a new lifestyle.
Yes.
What did you have to change to help you survive?
What I had to change is how I relate with people.
Yeah.
Because now I had to explain to people that before I accepted vitiligo, actually it was very hard for me. It was very hard for me, because you will undergo those stigmatization and everything. But after I accepted my vitiligo, I started appreciating myself. I started doing more research and educating people more about vitiligo, and accepting the condition that I am. and for them to accept me as I am.
Okay.
Yes.
Okay, thank you, Felix. And Dr. Margaret, just looking at Felix, there he's presenting himself, and the 4 types of vitiligo you had mentioned. What's happening around him? Where would you place him, Dr. Ari?
So Felix, I'd basically place him at segmental, which tends to occur bilateral, so both parts of the body. So you can see there's symmetry in terms of the presentation. Also, it's affecting around the eyes, the lips as well, and the hands. So that's very typical of segmental vitiligo. And segmental vitiligo. Segmental, ordinarily, you just see maybe one part of the hand affected. Again, most commonly, maybe in children, you find maybe it's just one hand or a leg. But then for him, it's mostly unsegmental. It's just bilateral on both sides of the body.
Okay.
Yeah.
And you mentioned, Felix, it started with the mouth. So did it take that short time? It was today mouth, turn eyes.
No,
So
no.
how long did it take? Take us through the journey.
Because when it started on the mouth, we started treating it, and actually it disappeared from the mouth.
Yeah.
But again, it reappeared on the lips again. So when it reappeared on the lips, it when it started appearing on these other parts. But it took it took quite some time, because we tried to treat it for quite some time, and it actually disappeared. But after some time, it came back, and when it came back is when I was diagnosed that it's vitiligo now. At first, we didn't know that it's vitiligo, but now it takes time. You can have this spot today, but for me nowadays, I don't even realize that they are spreading.
Yeah.
I don't even realize. It's people who realize. Because me, I don't realize, because you don't even feel anything.
Yeah.
Something that just happened. So you can have a spot here today, but again, it happens differently on different people. The rate at which my vitiligo has stayed for all these years, but it doesn't spread that much. Actually, it just got into my hands a few days ago. It has stayed mostly on my face area and the neck area, and just a patch here. Now it's when it's trying to spread, but it at a slow rate. For other people, you will find them having vitiligo today. The next time you are seeing them, it's almost the whole body is covered with vitiligo. Yeah, so the way it behaves in people, it's also not the same. Yes.
Is it painful? I know somebody would want to ask, is it painful?
For me, it's not painful.
Yeah.
Though when you get to the sun, it will burn you. So you need to cover yourself with sunscreen. Because the sun really burns, it burns. You know, there are no melanocytes here now. So you will get burns. That's the only time you can feel it's painful.
Okay.
But it's not painful. Even when the changes takes place, it's not painful, because you don't even realize.
Okay.
Yes.
Dr. Margaret, you know, saying when Felix gets to the sun, it's painful. Why is that?
Okay, so what happens, because of that loss of pigmentation, the melanin, now the sun's UV, ultraviolet light, can penetrate the skin and go deeper, because usually melanin tends to protect you from the damaging effects of the sun. So in this particular case, he needs to apply the sunscreen at least to protect him and cover those areas. So that's why it burns. And it's good to hear that he's applying sunscreen, because usually advise persons with living with vitiligo to apply sunscreen as a protective measure, because even when they get sunburns, you find that propagates the condition even more. So it's usually advised to wear sunscreen, of which he does. So
Yeah.
that's good.
Good
Yeah.
job, good job, Felix. And somebody might be looking at Felix and say, it looks like burns, albinism, let me say maybe segmented albinism. So what's the difference?
Okay, so the difference, so vitiligo tends again to occur as either chalk or milky white patches on the skin. And they tend to be in various parts of the body, so it's not usual to have your whole body involved as in albinism. And again, when you look at it characteristically, you can tell it's vitiligo, again, based on the various types that are there. So that's how you can easily differentiate. There are many other conditions that are similar, or you may confuse with vitiligo. One of them you said albinism, but again, the mechanism of albinism and this is totally different. Again, another condition you may find is something we call nevus anemicus, which basically is a birthmark. So you find you may be born, but there's a part of the skin that's a bit lighter.
Yes.
Yes, so those are just normal birthmarks, not really vitiligo. Again, there are some fungal conditions that, mimic vitiligo. They tend to occur on the chest, the back, the face, but it's fungal in nature. Another condition is leprosy, can also give you white patches on the skin, but it's different from vitiligo. Another one is there are many other skin conditions like psoriasis and what we call lupus. And sometimes when it's healing, it tends to leave lighter patches on the skin, which can be mistaken for vitiligo, but it takes a trained eye to really differentiate. But you can actually differentiate the many conditions from vitiligo. Yeah.
Okay. And if you're watching us right now, karibu sana. You're on Health Check, and tonight we're talking about vitiligo. Do you have any question or comment regarding our topic? Talk to us. Our SMS line is 20933. Of course, drop there your questions starting with the word Health Check, and we'll be getting to it. Or you can WhatsApp us. The number is 0708 222 323. That is 0708 222 323. That's our WhatsApp number. You can also get us live, by the way, on Facebook and YouTube. Our handle is at Hope TV Kenya Tonight. I host Dr. Margaret Gashanja, a dermatologist, and of course, Felix Owing. He's living with vitiligo. So we're looking forward to receiving your questions. We'll be doing that shortly after the break. So let me go back to Felix. So you've grown, this is happening, you've accepted yourself. What are some of the myths you've had around vitiligo that have shocked you?
There are always so many myths surrounding vitiligo. Just as we were discussing, some think that vitiligo is a burn, of which it's not. Some things that it's albinism, of which is not. Some things that vitiligo, you got it from a curse, which is not. Yes. Some things that vitiligo, some children were born and, I don't know, twins. There is something like twins and you passed something, I don't know. I always don't understand that part. Yeah, and also people always think that vitiligo is contagious. Like when I touch you, you'll get vitiligo, which is not. It's necessarily not. Yeah.
Wow.
Yes.
Dr. Gashanja, what have you had around as patients come to you every day? What have you had?
So what she has already mentioned about them thinking that it's contagious, they think that because they have it, if they touch someone else, it can be passed on, of which is not true. Another myth I've had is that it can be caused by consuming certain food types. Some people say citrus foods, something like that. So it has no relation to diet. So some people assume it's something they ate. Another thing that maybe parents tend to think about, especially for children, they tend to get vitiligo around the genital region. So some parents assume that, maybe it came about due to a diaper rash, the same mtoto alichomeka, na napi or something, but that's just a myth. Usually vitiligo doesn't have any outward thing that brings it. And also for adults, as you said, people sometimes think it's witchcraft or someone, looked at you with an evil eye or something. But so those are some of the myths that I've come across. Yeah.
And as a patient presents themselves to you, Dr. Margaret, what's the first call to action, as maybe bring a child to you and say, I don't understand my child. So take us through the journey you take this parent through towards helping and, diagnosing that it's vitiligo and this is what we need to do towards treatment.
Okay, so basically when a patient comes, whether a child or an adult, usually we take a good history and find out in terms of the patches, when they started, how they are progressing, and also the area involved, because usually treatment tends to be targeted based in terms of the age, the area located. So there's a lot of counseling that goes, especially if it's parents who have brought a young child or even for adults, at least to demystify what vitiligo is about. So the main thing that we take time to do is to actually counsel the patients, to make them understand how vitiligo comes about, to know that it's nothing that they did to make it come. It's just their own immune system which doesn't mean it's weak or too strong. It just means it's misbehaving. And once at least they can understand that, we are able now to start the journey of treatment slowly, because as you said, it's something that can progress gradually. And so usually the main thing is counseling, and then we tailor make a treatment plan for the patient. Yeah.
Okay, per patient. And for Felix, so diagnosed with it and stigma. You know, at the beginning you mentioned you went through some stigma. Would you want to point out, and how did you manage that to be able to stand? You look courageous and you love you know, which is
Yeah,
something
sure,
you're
yeah.
celebrating you about. Yeah.
So the stigma is in the point that your relationship with people will change, because now people will now tend to view you in another way. They will want the friends that you had before won't associate with you the way they were before your skin started changing. So first I lost friends. I was in music and drama school. I couldn't get a spot.
In high school.
Yes, I couldn't get a spot to go for those gigs because of just my condition. Because now I will synchronize with the other students. Maybe we are doing a choral verse or something. So it won't, that picture, people will view it in another perspective. And those are the things that pushed me really into modeling, because I just wanted an avenue where I can create more awareness. So I decided just to venture in modeling, because I thought that's the good avenue which can help me create the awareness. And it's also my passion. I like modeling and taking pictures, and yeah.
And what support did you get, you know, from family setup for you?
Actually, the first support you can appreciate is the family, because they just keep on encouraging you, accepting you the way you are, taking you to counseling sessions. Yeah. Yes.
Anything else?
Just counseling, and also encouraging you to accept yourself, helping you with the journey, with the creating the awareness, exposing you out there. You know, so many parents have kids with vitiligo, but they don't expose them out there. But when you expose a kid at a younger age with vitiligo, it helps them. It helps them with the acceptance, other than letting them growing old with the vitiligo and not exposing them out there. Yes.
Yeah. So talk about the great things you're doing around modeling.
So vitiligo has really helped me in my modeling career, because it's art. Vitiligo itself, it's art, and modeling is art. So it has really helped me in my career. I'm happy that nowadays brands are really starting to appreciate, and just in that inclusivity and diversity way, to create also more awareness. So I'm happy that I'm in that space, and yeah, we are doing great things. Yes, as a model, and also as an organization. By the way, we have an organization.
Yes, talk about that.
A group of people living with vitiligo. Like it's just a small group. It's called Royal Patches, under the Vitiligo Society of Kenya. So it's a small group of people living with vitiligo, where we just create awareness. We do counseling sessions. We nurture talents. Yes. Yeah.
Okay. And where can people find you?
Where people can find
Yes,
can find
in
us.
terms of the organization you're running to support people with vitiligo.
On the organization, you can find us in all social media accounts, Royal Patches Kenya. Yeah. Or you can just reach out to me directly at Kenya Vitiligo Finest. Yes. All across social media. And also we are having World Vitiligo Day on this coming Sunday on 25th June.
Okay.
Yeah, being organized by our group, Royal Patches,
Okay.
at YMCA Central branch. So I welcome you all to come.
Okay.
For
Thank
the day.
you. And Dr. Margaret, just listening to this great man, you know, very courageous,
Yes.
and he just loves him.
Yes.
You know, and I know you interact with so many parents who feel ashamed of having children with vitiligo, or even themselves, they discover they have it and they want to hide, would you just talk to them? What's the best way moving forward? Because they still have to live. They still have to survive. They still have to get something to eat. They still have to work.
True.
Yeah.
So what I'd advise them is, first and foremost, is that you're beautiful the way you are. And as you've said, it's like a masterpiece. When you look at him, it's like a piece of art, it's beautiful.
Yeah.
So it's just to accept that, beauty comes in various shapes and sizes and skin color. And number two is that, there are treatment options available to manage the condition. And number three is also to embrace yourself, have self-love, self-acceptance, and that will build your self-confidence. Also, to join vibrant societies, like he's mentioned, of persons, who are living with vitiligo, because that creates a sense of community, so you're able to at least have people who are like you, and you're able to share any challenges that you might have.
Yeah. I thought it's just come, allow us to go to a break. When we come back, I'd love you to address teachers and the support. Felix has just said, once vitiligo began coming, couldn't engage in drama, couldn't engage in music, and yet those were his passion. Just speaking to teachers on how to support, especially children. When you're an adult, utapambana na hali yako, as society would say. So how teachers can support children who have vitiligo in that space. That is when we come back right here at Health Tech on Hope TV Look and Live. I hope you will. And of course, we'll be looking at your questions. Engage with us. Our SMS line is 20933. Send there your question beginning with the word health check. And you can also WhatsApp us 0708 222 323. The numbers are right at the bottom of your screen. We're also live on Facebook and YouTube at Hope TV Kenya. We'll be right back.
Every Wednesday at 7:30 p.m. Spotlight.
Do you feel that they are in a place where they can effect a Barack Obama moment?
When you hear the word of God and you hear Jesus is speaking.
Real talk on real issues.
The Bible says faith without works is dead.
The truth of the gospel that will survive the time is not a health and wealth gospel.
When there is time to harmonize and bring one composite amendment.
With idealistic, thought-provoking guests.
So people come to be serviced, to be encouraged, to be empowered.
When the storm is over, you desire the closeness you have with God.
Hosted by Reverend Edward Furi. Hope TV is where you look and live, with an excellent selection of the best Christian programming consisting of local and international content, of inspirational stories, talk shows, Bible commentary, youth, health shows, children entertainment, contemporary gospel music, extended times of worship, live broadcast, news, movies, drama, Christian ministry programs, and so much more. Hope TV is another quality service from Christ is the Answer Ministries, with over 45% of authentic and credible local content every week. Hope TV is a sister station to Hope FM, Kenya's leading Christian radio station, with footprints across the country. Tune in to Hope TV, where you look and live.
Health Check right here, Top TV Look and Live. We hope you're well. And if you're joining us, you're not so late. We have a few minutes before we wrap up the program. We're talking about vitiligo, a skin condition that causes you to have some patches in different places. And of course, you're looking forward to receiving your questions and comments. Our SMS line is 20933. Begin your question with the word health check. And of course, you can engage with us. WhatsApp 0708 222 323, and we are live on Facebook and YouTube at Hope TV Kenya. I'm hosting Dr. Margaret Gashanja. She's a dermatologist, and of course, Felix Owing, who is living with vitiligo. Before we went on break, Dr. Margaret, we were to talk to teachers. Those are the people who interact with our children every single day. Maybe even today, a teacher has just discovered, huyu mtoto lips zake kuna kitu ina happen ama mkono, you know, and discrimination begins there. Would you talk to teachers who are watching us tonight?
Yes, so I'd wish to tell the teachers out there that, you know, vitiligo is a condition that just happens on its own. It's not contagious. Again, it's not something that you need to seclude the students who have vitiligo, you know, from achieving all they needed to do. And also it's something that we need to break that social stigma that's currently there. So Grace, I do agree there's a lot of work to be done. We need to reach out to teachers, caregivers, basically our whole society to have a better understanding of what vitiligo is about and not to suppress or, you know, prevent people from living their best lives because they have the condition. It's just a normal condition like any other. And we really need to break those, you know, myths and demystify what vitiligo is about. So there is a lot of work to do, but teachers should really, because they're the ones in contact with the students in those early stages, they really need to do their best to be inclusive when it comes to persons with vitiligo.
Okay.
Yeah.
So let's get to treatment. What are the treatment options for persons with vitiligo?
So treatment for vitiligo, I'd categorize it into two. So there are those general measures that you can do. First and foremost of which Felix said is doing is to protect yourself from the sun because as we said earlier, sunburn can propagate or worsen vitiligo. So you need to protect yourself from the sun. Number two, you need to wear loose clothing and also avoid friction because areas of friction tend to be prone to develop vitiligo, like the hands, you know, that repetitive friction of the mouth, the eyelids. So it's important to wear loose-fitting clothing to avoid that friction because any sort of trauma, you know, cut or graze on the skin can lead to development of new lesions. And also another general measure that's out there, you can actually have some products that have cosmetic camouflage when it comes to vitiligo. So there are products out there that come in the form of makeup or dyes or paints, which can be used for people who want to perhaps, you know, are not feeling so self-confident. They can apply it on the patches of vitiligo and it can match your skin tone, and some are even waterproof. So there are those measures that someone can take if they so wish. The other more specific treatment is in terms of topical medications. So we usually have topical treatments that we can give to apply on the patches on the skin.
Yeah.
So this usually decrease that abnormal inflammation that's happening, that's leading to the depigmentation of the skin. Another method is oral medication, which we call systemic medication. This one we usually give, especially when we've noticed someone has come to us and they've just developed vitiligo and it's currently in the active phase of spreading. We can give you oral medication to at least halt that process before it spreads even faster. Another mode of treatment is something we call phototherapy. So there are two forms. There's one called PUVA, which is basically, it means Soralen using UV ultraviolet A. So we give our patients Soralen and then we expose them to ultraviolet A light.
What is Soralen?
Soralen is a type of medication that usually sensitizes your skin. When we apply it on your skin in whichever form, even oral, and then we expose you to a specific light, which we are now calling UVA, ultraviolet A.
Yes.
That can trigger your skin to start repigmenting. So that's one form. Another form is called narrowband UVB. So this one we expose a patient to a wavelength of ultraviolet B light, which can also trigger repigmentation. Another form of treatment, however not too common, is what we call depigmentation. So if at all you have extensive vitiligo, as opposed to us trying to return your skin pigment, we can't give you medication to totally depigment the small patches which are left. You know, case in point, maybe someone like Michael Jackson. So you depigment your whole body because the patches which were there, you know, are too few to try cover the extensive depigmentation that was already there. Another form of treatment is surgery, where you can excise the top layer of the vitiligo affected skin, and then you remove skin from a different part of the body which has the melanin cells,
Yes.
and then you transfer it to that area. So those are the various modes of treatment that someone can undertake when it comes to vitiligo. Yes.
What about traditional medicine. You know, can traditional medicine do something? And also just buying medicine over the counter, you know, the way Dr. Google, chaka, 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 what do I do? Then Dr. Google tells you there are these 6 other products, then you just walk in and buy. Talk about that.
True. There are those remedies that people do try out there, but unfortunately, most often than not, they do fail because most of them haven't been tried and tested in the scientific world. So there's no proven effect of those treatments when it comes to vitiligo, because vitiligo in itself, the way it forms, it's a science to it. So unlikely that, you know, anything that, you know, mitishamba could really do much. Though, on the contrary, there are some, you know, newer products out there, some oral medications, even some multivitamins, some herbal preparations that, to some extent, do help with vitiligo. So it's a matter of, you know, trial and error and seeing what works for you, what doesn't. Because I understand that some patients are, you know, very desperate to, you know, have a sort of repigmentation happening and some sort of cure. So we are open, but science is still evolving to try find a cure for vitiligo. But in the meantime, at the moment, those are the main forms of treatment that are out there.
Okay. At least to see Dr. Margaret is the first option.
Yes,
The safest.
yes.
Okay. Did you ever receive options, Felix? Try this. This will sort you out.
Yes.
Yes.
Yes,
Which ones?
I tried clinical options and also the herbal ones. But I find out that they are not responding to my condition.
Yes.
Yeah, and also those the challenge is that those the medications they are always somehow expensive. Yeah. So once I reached that point of accepting myself, I left using medications, me myself. Nowadays I don't use medication. I'm just there.
Okay.
Yeah,
So how are you managing it?
Just accepting myself, appreciating my beauty, and being me. It's normal. I just it's from to me it's normal.
Yes.
Yeah.
Accepting me.
Accepting
That's
me.
what I've underlined.
Yeah.
Okay. Okay. And what would you what would be your message before I come back to Dr. Margaret to, you know, the government is here. Maybe even they're not aware there is this condition. You know, do you feel you're getting enough support from the government for persons living with vitiligo? And what would you want to tell the government to do to help make it easy for you?
Actually, I don't think we are getting enough support from the government, because just as I mentioned before, we are having World Vitiligo Day coming this Sunday. And these are days that the government should, like the ministry which is concerned with this docket, should pick up and organize, just like the other days you will find the government organize for let's say World Mental Health Day, World Cancer Awareness Day, World Sickle Cell, Autism, Albinism, but vitiligo is more of neglected by the government. So I think these are the areas that the government should just come in, because as a small group organizing this big event, this international event, is not easy on us. Yeah. So and also on the people living with vitiligo needs to use the sunscreens a lot of the times. These sunscreens are very expensive on the counters. When you go and get them, and they are very expensive. So the government introduced a program of providing persons with vitiligo with free sunscreens, of which I don't think that they have exhausted it enough, because these sunscreens are still not enough for these people, and how the procedure that they should follow to get these sunscreens are not laid down well. So I think those are the areas that the government should just pick up. And also on the registration, you see nowadays they classify vitiligo as under PWD, persons living with disability.
Yeah.
So on you'll find so many people would like to be registered under that, but the laid down procedure for vitiligo is not clear enough. Yeah, so those are the areas that the government can just at least adjust to also assist us as and help us create the awareness, and also, yeah.
Okay. Serikali wamesikia. I know they watch this show. Wamesikia na watahakikisha before Sunday as you're celebrating World Vitiligo Day, they'll do something.
They should.
So, Dr. Margaret, let's get to a few questions that have come through for you. Can vitiligo increase the chances of one getting skin cancer?
So vitiligo, in terms of its cause, it is a chronic condition, meaning long term. But based on how the science behind it and how it comes into being, no, the answer to that is no. It cannot lead to an increase in chances of getting cancer. The two are totally different. So the simple answer to that is no. It cannot lead to cancer.
Okay.
Yes.
One more. How does one tell it's vitiligo? And at what point can one say it's vitiligo apart from skin conditions?
Okay. Usually, if I'd advise the person asking the question, if at all they do suspect they have some depigmentation of the skin or white patches on the skin, first and foremost, it would be important to seek a skin specialist to be able to do that sort of diagnosis. Because usually with a trained eye, you're able to tell this is vitiligo or not. Other than that, we do use other modalities to try diagnose vitiligo. We use another light called a Wood's lamp that can be able to illuminate the skin and you can be able to differentiate, is this a fungal infection, is this vitiligo? We also have something called a dermatoscope that we use to look at the skin. So again, that vitiligo illuminates differently. Also, we can do a skin biopsy to be able to determine this is vitiligo or not. So clinically is the best way to differentiate vitiligo from other conditions. So mostly I'd advise them to seek a skin specialist to be able to make that clear distinction.
Okay.
Yeah.
And by skin specialist, you mean a
Dermatologist, exactly.
Yeah, lest we go to funny places.
Oh yes, a dermatologist.
Okay, and where do we get these dermatologists, Dr. Margaret?
Okay, so they are we are not too many, but we are available. So in various, Nairobi County, majority of the dermatologists are here. We are also located in various parts of the country, like Makueni County, Kiambu County, Nakuru County, Kisumu. So we are widespread in various counties. So we are there, I guess, we are few. That's why we are not, known, but we are there.
Okay,
yes.
Thank you. This one says, Daktari, I have some patches on my face. I went to the hospital and I was told it's fungal infection. Treated, disappeared, and reoccurred. It was treated and came back the third time. I'm now on medication now, a bit responding well. What could it be, Daktari? Can it turn into vitiligo?
Okay. I'd possibly need to find out more about and see that patient maybe to be able to differentiate, because I would not rule out that that could actually be a fungal infection, because there are some fungal infections that you treat once, but they tend to recur again. Because the nature of an infection is that even though you're infected once, there's a chance you can be reinfected again. If it was vitiligo, the management is totally different. As you've heard from Felix, sometimes you treat, and yes, you can have an improvement and you get repigmentation of the skin. But then you may notice even as much as you're treating, new patches are occurring. But I feel that we'd possibly need to see the patient to really confirm whether that is vitiligo or it's actually true a fungal infection, because fungal infections do tend to come and go, and maybe that's what that is. But if he or she's in a facility where they can, refer to a specialist, a dermatologist, that would be most ideal.
Okay.
Yeah.
Now that you're talking about fungal infection, if I have that, it's sounding to me as if there is something I'll see wherever, any part of the body. So how can I be able to differentiate this is a fungal infection from vitiligo?
Okay, so the
characteristics sort of.
Okay. So the fungal infection, in case that tends to mimic vitiligo, is a condition we usually call pityriasis versicolor. So basically, that one looks like light patches on the skin. But usually, if you were to stretch that skin, it will look like it's flaking or scaling off, as opposed to vitiligo. If you try to, touch vitiligo and stretch the skin, it will not fall off. It will not be flaky. So most fungal infections, just from the common eye, they can be flaky and maybe itchy, of which vitiligo is not. So most infections tend to be itchy, flaking, maybe a bit red, of which vitiligo would not. So maybe that's an easier way to differentiate between the two. Yeah.
As you're saying, I could see Felix trying
Checking.
to check. It's not itchy and it's not flaking.
Yeah.
Thank you for that. So are there some complications that come with vitiligo?
So the main complications of vitiligo is basically psychosocial stressors that come with vitiligo, which we've heard from Felix. So the main thing is a lot of social stigma around vitiligo, which can really put someone down and lower their self-confidence. So that's usually the main complication. Another complication could be vitiligo being an autoimmune condition. It can predispose you or put you at a higher risk to develop other autoimmune conditions. So you find when we see someone with vitiligo, we want to investigate, do they have a chance of getting diabetes? Do they have a chance of developing a thyroid condition? So those would be the main risks associated with vitiligo. Other than that, it tends to run a very benign course. Benign meaning it will never become cancer.
Yes.
And individuals with vitiligo can lead a happy, healthy life. Yes.
Yeah, are there foods, you know, one can eat, things one can do so as not to get vitiligo?
Vitiligo. In terms of prevention of vitiligo, unfortunately, there's nothing out there to prevent vitiligo. It just comes on its own. But we talk about aggressive management of vitiligo. The moment you notice it comes, that's a way to prevent it from becoming worse and spreading to other parts of the body. So basically seeking help as soon as possible for us to initiate aggressive treatment to help repigment the skin and stop further progression of the condition. Yeah, but nothing in terms of diet or anything topical, no. There's nothing you can do to prevent it.
Even eating too much oranges can't help?
Apparently, no. I wish, but no.
That's a myth.
I know, it's a myth. It's a myth, yeah.
Okay. Before we get to hear Felix thoughts on a question I have, is there an age that is at risk of getting vitiligo?
So in terms of age, unfortunately, everyone is at risk of getting vitiligo, but it tends to occur again in those two peaks. Usually there's an early onset, so under 10-year-olds are at risk of getting vitiligo, again around the age of 30. And then furthermore, in older age groups or later in life, when individuals have already started developing other autoimmune conditions, like someone already has diabetes, someone has another skin condition we call psoriasis, thyroid disease, you may find that vitiligo is starting to develop in those age groups because of the other existing autoimmune conditions. But ordinarily, any age, you can get vitiligo at any point in life.
Okay, thank you. Let's go now to Felix as we try to wrap it, up. I would love you to speak to 3 categories of people. Number 1, somebody watching as a viewer and has just been diagnosed that this is vitiligo and you need to adjust your life around it. 2, speak to parents who have children with vitiligo on how they can support them. And number 3, speak to anyone watching and has it and is celebrating, they're energetic. What would you want to tell these 3 categories of people?
So the category 1 was the first one, was the person who has been just diagnosed with vitiligo. What I'll tell someone who has just been diagnosed with vitiligo is to first seek counseling sessions as they try the available treatments. Yes, they can also look for these groups of persons living with the same conditions, which will really offer support to them. And then what I'll tell parents who have children living with vitiligo is that to expose their children to counseling and groups with the people living with vitiligo, they shouldn't lock their children in the houses. They should let them interact freely as they try to counsel them on the condition. Because, children are always innocent, they don't know. But when they see the colors starting to change, it affects them. They will have that stigma. So I'll just tell the parents to at least try to expose their children whenever they see a change or whenever they get their children diagnosed with vitiligo. Okay. And again, what I'll tell someone who has vitiligo is proud of it is that big up, because this God's art. Yeah, it's an art. It's beautiful, and we should appreciate the way we are.
Okay.
Yeah.
Thank you, Felix.
Thank you.
Dr. Margaret, what is your parting shot?
My parting shot is basically that as a society, we need to educate ourselves. There's a lot that people don't know about vitiligo, and we need to understand what it is and also be able to understand the persons living with vitiligo so that we are able to embrace their uniqueness and, enhance that inclusivity when it comes to, the world. And also people who have vitiligo, I'd advise them to continue, just like Felix is a very good example, to continue being vibrant and, they have a lot of self-acceptance, self-confidence, which is very good. And that, for people who want to seek treatment, we are there to help and to treat, and we can tailor-make each mode of treatment as per an individual. So they can also seek help, and that this journey, they need not walk it alone. Yes.
Thank you, thank you, thank you, Dr. Margaret. Thank you, Felix, for
Thank you
gracing us
for
today. And may God bless you for the great work you're doing.
Thank you.
Thank you.
Helping make our faces look good.
Thank you.
Helping patients who have vitiligo, and Felix just going out there, celebrating God's creation and God's art. I've learned that today. This is God's masterpiece
Yes.
of art. I celebrate you and the great work you're doing together with your
so
team.
much. Thank
Keep
you
shining.
Thank you so much.
Okay. That's all we had for you on Health Check tonight. I hope that you have learned a thing or two. People with vitiligo, it's not infectious, by the way. Okay, it's not painful. But you can live with it and excel, and there is treatment for you. You need to visit a dermatologist and get help. And like Felix said, it's God's masterpiece. Beautiful, beautiful piece, and God never makes a mistake. My name is Grace Mutiso. Wish you a blessed time. Remember to join us again next week on Tuesday for another episode of Health Check. Of course, different topic, different guest, and I know we are going to learn together. Catch a repeat of this. That should be tomorrow, and of course on Saturday, and anytime at Hope TV Kenya on Facebook and YouTube. Have a beautiful evening and keep it right here at Hope TV. There is more coming up for you, including Newswatch. Bye-bye for now.